Now, onto this story that's catching everyone's eyes. It's grabbed headlines. It's about eggs. Now, eggs is a daily staple in millions of homes, but now they are under regulatory scrutiny. The food safety watchdog has ordered checks across the country on eggs, and this follows questions that have been raised on the quality and safety of eggs. What exactly is being tested, why it matters, especially for children, and what is the regulator going to do next? My colleague Himakshi is here to put that in context. Himakshi, if you can lay the context, because we are going to discuss this with a health expert, but tell us about why eggs are in focus and what the authorities are doing about it.
Well, absolutely. So let's just break down what the Eggoz egg controversy is all about, and also why food safety regulators have stepped in. So the Food Safety and Standards Authority of India, that is the FSSAI, has now directed its regional offices across the country to collect samples of both the branded and unbranded eggs. So these samples will be tested at 10 laboratories nationwide to check for the presence of nitrofurans. Now, what exactly are nitrofurans? So these are a group of antibiotics that are completely banned in the food producing animals. And why they are banned? Because studies have shown that they can have toxic, cancer-causing and genetic damage-linked effects in the humans. And the concerns becomes even more serious when it comes to children. So doctors have warned that young children are especially vulnerable because their organs and immune systems are still developing. So long-term exposure can potentially lead to liver damage and also weakened immunity and growth-related issues. So this entire issue has, come into focus after allegations surfaced regarding the possible presence of nitrofurans in the eggs supplied by Eggoz, triggering a wider safety review there. So now it's important to, really note that Eggoz has denied these allegations. The company says that it has publicly shared its lab reports claiming that no antibiotics, banned substances or pesticides were detected in their egg samples, and also that all the results were below the detectable limit, and that's there available in their websites. So where does this leave the consumers? For now, FSSAI's action is a precautionary system-wide check, not just against one brand. It's the regulator, wanting to ensure that the eggs across the supply chain meet the safety standards. So the bottom line is food safety watchdogs are tightening the checks. Companies are being asked to maintain transparency, and consumers are being advised to buy, from regulated, reliable sources while the test results are awaited.
Yes, that's exactly what's happening, Himakshi. Now, egg safety is coming under the scanner. The food regulator, like you said, testing eggs nationwide for banned antibiotics. Let's get a health expert in to ask us about the concerns. Dr. Samit Purohit is Director for Medical Oncology at the Action Cancer Hospital in Delhi, and he's here to help us understand the health risks and what families should know. So, Dr. Purohit, thanks for making the time. Just wanted to check with you at a basic level. Tell us, how serious is the health risk if these banned antibiotics like nitrofurans are actually found in eggs?
Yes, thank you for having me here. So I think it's been blown a bit out of proportion.
Okay.
So these antibiotics like nitroimidazoles and nitrofurans were used at one point of time as antibiotics for poultry and animal farming. And traces can be found in eggs or later on, but the permissible limit is below 1. And I believe the test which was done on this particular company found it to be below 1. So that was a kind of safe limit. Again, cancer is a multifactorial thing. So just putting one blame on egg is not the right way. Egg are still very safe, very, a cheap source of proteins, fats, and even antioxidants. So I don't think there is anything to be worried of.
What about the exposure to children, which they are saying is that much more dangerous? If parents are actually worried right now, you're saying they should not reduce egg consumption for children, or you think that's just unnecessary panic?
So usually they say moderate consumption of egg, like 1 egg per day, is very safe limit. That can be done very easily.
Okay.
And there have been studies which have shown that there may be some risk, but all those studies have been just observational studies, and there is no concrete evidence as of now.
Are there any signs or symptoms, doctor? Should parents watch out for any signs, any symptoms in children that could indicate a problem?
So I don't think as of now, anyways, if the children are behaving other than their routine things, or a GI, a stomach upset is there, or change in bowel habits is there, or they complain of recurrent nausea or vomiting, then these may be alarming symptoms, but I don't think there is anything to worry for.
Do you think cooking eggs thoroughly could reduce any kind of risk, or do these antibiotic residues that we are talking about, they remain even after cooking, so that doesn't necessarily solve the problem even if you identify it as a problem?
So type of cooking, mode of cooking would actually not get rid of any of these antibiotics. And even the experiments which suggested that these antibiotics in heavy doses may cause cancer was in experimental animals, and these were pretty high doses. So comparing those doses with this is not, I think, the right thing.
Right, so there is this concern about a long-term exposure, right? This is something that has been highlighted, not just in this case, but in the kind of food items that we consume. And here we're talking about antibiotics, but in general, for the kind of treatment that our foods, the kinds that we consume today, when there is long-term exposure, what kind of health issues could prolonged intake potentially lead to?
So most of these things like antibiotics or palm oils are DNA damaging agents. So repeated exposure to them, what happens is that DNA is being damaged every day, and the repair mechanism is not working the right way it should be. So when this repair mechanism becomes haywire, then that is when the cancer arises. But again, as I said, it's a multifactorial. Not only diet, your sedentary lifestyle, your alcohol exposure, your secondhand smoking. So all these they do a cumulative. They result in cancer in a body.
So now, how important are these nationwide tests that the FSSAI is conducting in preventing any long-term public health issues? What do you see as their role over here?
So I think their role is very important. They need to be very stringent, keep a constant check on the safety limits of all these antibiotics, and most of these antibiotics have been banned, and even the permissible limit, as I said, was below 1. So what in particular, one source they found it as 0.74, and rest most of them have been really normal. So I think it plays a very important role, especially food being very important, and for kids when they take a lot of food, junk food, and we see a lot of things coming up. So I think they have play a very pivotal role in preventing and taking care of our health.
Sure, Doctor, thank you so much for breaking this down for us, and very clearly at that, what is evident is that this is about precaution and vigilance. One should not really panic. The regulator, of course, is testing and companies are responding. Consumers need clear science-based information. So indeed, we'll be watching out for that, and we'll be connecting you with our health experts and getting you the right information. But for the moment, it's time for me to wrap up this edition of Profit 360. I'm Vikram Oza from me and the team. Thank you for joining us, and we hope you have a fantastic evening ahead. Bye-bye.